SI joint pain and kinesiology taping. First of all, what is the sacroiliac joint, the SIJ? It is the joint between the ilium and the sacrum in the pelvis. So you can see it here in this diagram. It's a synovial plane joint and it's very, very strong. It supports the whole body weight and is connected by a number of very tough ligaments that secure it between the sacrum and the ilium. You will often hear people talk about misalignment in the pelvis, the SI joint, etc., etc. But I'd like to question that. One, there's a very limited range of motion in this joint. It's not very easy to measure, but it's thought to simply be a couple of millimeters. Secondly, the ligaments that support this joint are very strong, some of the strongest in the body. But then why is it that people tend to complain of oversensitization or pain in the region of these SI joints? Are we looking at a case of oversensitized tissue and connective tissues in that area, rather than any kind of hypermobility or misalignment through that joint? There are thought to be many reasons as to why people feel pain in the SI joint region. Sometimes arthritis can be at play. People do get arthritis in the SI joint. There's also a condition called sacroiliitis. This can cause pain in that area, but is a lot less common. What is much more common, and what I see a lot more in clinic, is suboptimal loading patterns in the body. This, for example, is someone who's quite one-sided. They may have an element of rotation functionally from the activities they do, their hobbies, their jobs. And this has resulted in pull or loss of dynamic between some of the soft tissues that causes pulling and sensitization in that area of the SI joint. Another population where we tend to see SI joint pain quite commonly is in the pre- and postnatal population. Again, increased relaxin during the pregnancy phase and increased mobility in the pelvis might be a contributing factor as to why they feel that oversensitization or pain in the SI joint area. As we move into the postnatal phase, obviously having that increased mobility, the effects of which can last for 6 to 12 months, coupled with mechanics of carrying children, one-sided behaviours, picking up car seats, can again result in suboptimal loading of the pelvis and the body, resulting in pain through that area. Thorough assessment is really important when we're looking at SI joint pain. Often overactive glutes, hip rotators, lower back tightness, lots of different contributing factors and pulls on the back of the pelvis that might result in that sensitization. And that will really drive your treatment goals, your home care, and then what taping is really appropriate for that client. I'm going to show you an example taping here of a client who's very lordotic, very short, tight lumbar erectors and quadratus lumborum muscles that is creating a pull on the back of the pelvis, and she's feeling that as bilateral pain across the SI joints on both sides. I would say it's equally common in practice to see SI joint pain that's only one-sided, unilateral. And in that case, I would be looking at my taping from side to side to be quite different, trying to deload and desensitize where that client is feeling the pain. So in terms of options, I'm going to show you an inhibition of the lower back on both sides and a general desensitization across both SI joints. Other options are to, for example, inhibit the glutes, lateral hip rotators, if you feel they are what is palpating and what is testing as the short, tight contributing factor. You could even just do a desensitization directly over one SI joint. You could load that up and do a star taping across that one SI joint. It really depends on your client, what they present with, and what you find in your hands-on treatment. So let's have a go at this taping, but bear in mind your own clients and how you might differ the taping that you would apply. An inhibition. So I'm going to anchor the tape at the back of the pelvis. I'm going to peel off the anchors, first couple of inches, and I'm going to anchor that with no tension on the tape, no stretch on the tissue. And I'm going to anchor both pieces of tape at the same time to kind of minimize how much my client needs to move during this taping. So it's just an efficiency thing. Next, I'm going to ask my client to flex forward, so putting that tissue on stretch. Next, inhibition, light amount of stretch on the tape and rubbing it down along the lumbar muscles. Again, other side, light amount of stretch on the tissue and laying that down onto stretched tissue. Peeling back the tape and simply anchoring with no tension on the tape and no stretch on the tissue. Next, to desensitize the SI joint. So here I'm using a 10 centimeter piece of tape because this client complains of a dull throb across the whole of the back of that SI joint region. So this will just cover a greater amount of tissue, so get a greater amount of desensitization. If your client was feeling the pain more locally, then a smaller amount of tape directly over that area is sufficient. So middle of the tape down first, light amount of stretch on the tape, client stretched into flexion. Rub well to stick and simply anchor with no tension.